Well, let's now focus on the situation in Kerala and on Delhi as well. Now, with a test positivity ratio of 19%, Kerala accounts for over 70% of active COVID cases in the country. Cases surged after Onam celebrations when restrictions were relaxed slightly. And on Friday, the government announced that they will continue with the Sunday lockdown and bring back the night curfew starting today from Monday. The Kerala government has also issued an order to conduct a sero survey in the state. Now, if we take a look at the situation in Delhi, which also experienced very bad COVID during the second wave, well, good news there is Delhi recorded 0 COVID deaths for the 4th consecutive day on Sunday, according to the health bulletin. And the national capital saw 31 new COVID cases during this period, pushing the tally of COVID cases to over 14.37 lakh, while the death toll comes to 25,080. But the cases, that you can see, really coming down. Well, to talk more about this situation in Delhi and in Kerala, we're joined by Dr. Padmanabha Shenoy, immunologist, Kochi, and Dr. S.K. Sareen, Director, ILBS, and Chairman, Delhi Government's panel on COVID. Dr. Shenoy, first to you, if you could, tell us more about the situation in Kerala. The government there has said that the cases are plateauing. They feel they're plateauing now, and they also keep emphasizing how the death numbers have remained low.
No, both are wrong statements. I don't think government has told that. See, cases are not plateauing. Actually, when we look at week on week, Kerala's R0 is 1.5. That is a 50% increase in cases week on week, which is highest in last 4 months. From the month of April last, we had a R0 of 1.4. After that, this is the highest. 1.5 means it is each person is giving the disease to 1.5 another person. So it is going to be an exponential rise. This week we may like to see around 40,000 cases. And week on week you see 18,000 cases were the last week. Now it is becoming 25,000 per day average. And despite increase in testing has increased by 25,000. Despite that, the TPR has risen by 2.5. Once the testing increase, what we usually expect is TPR is going to come down. So all these things indicate that there is a tough week ahead for Kerala. But another very good thing, silver lining, we should always see is that Kerala has vaccinated maximum in the country. So Kerala has vaccinated 25% of the double jab and 71% has received the single dose. That's a huge number. So even if the cases increase, the sick number of patients are decreasing. So that is a good thing. So the number of ICU occupancy is slightly less when compared to earlier. Initially it was 2.5%. Now it has come down to 1.2%. And ventilator occupancy has come down from 1.3% to 0.6%. So what is currently seen is that Kerala may be able to handle active cases around 3 lakh. Now it is 2.1 lakh. So the problem is, if there is an exponential rise of to 40 to 45,000 cases and they stay there for a couple of weeks, Kerala's healthcare may have a strain on it. So that is a worrying thing. But the currently what is happening is there is ventilators, but the ventilators are around 10 to 15% ventilators are only vacant. In some districts there are no ventilators in government sector. So situation is not very, very safe. But yes, we do not worry too much. But we have to be cautious.
All right, but you do think that the cases are going to go up even more? You said exponential, and so this Onam spike that we're seeing, you feel it's going to rise even further. Also, the state government has asked for a sero survey to be conducted in the state. If you could tell us about that in significance of it.
The cases will go up, Gargi, that's for sure. Last year we had a 4 times increase in the cases from 2,000 to 8,000. So this time it can be double at least. 20,000 was the pre-Onam, and we will see something around 40 to 45,000 coming weeks. Zero survey is a welcome move because some districts in Kerala may have less zero prevalence, and their vaccination can be ramped up, and people can be given more vaccines can be given in those areas. So that is a very welcome move, and what we expect currently is around 60 to 65% to 70%. Up to 70% of the people would have some kind of immunity in Kerala. It was 42% in the month of May, and now over last 3 months, vaccination has picked up. A lot of people got infected. So now the figures will be something around 65%.
All right, Dr. Sareen, if we talk about Delhi, the situation has really come under control. Cases are less. We've had 0 deaths in the last 4 days, which is really, really welcome news. What are your fears now, or where do you think we need to be cautious? I do know that, everybody's talking about how people are moving around without fear. We're also going to be going into a festival season. So what do you think Delhi needs to do right now?
Yeah, I think the Delhi Disaster Management Authority, which is the one which has decided to open the schools and 50% capacity, and I think it's a welcome move. But the challenge will remain for all of us, that the school opening should not have a trend or infections to the kids. I would suggest the following. First, the teachers should have had at least 2 shots and the parents from where the kids are coming should also have had 2 shots. The only fear is that the kid might get infected in the school, but if the teachers are done well, it's okay. And if the parents are vaccinated well, so the kids will not bring the infection back home. Then, of course, all the norms should be followed in the schools like for anywhere else. And I know the kids in Delhi are smarter, and they will follow the rules, will wear the masks and not open their, eating and tiffin boxes with each other, so that they sit separately and maintain the, distances. And if any kid is sick by any chance or is apparent, the school authorities, the parents must not send that kid to the school. The second fear, of course, is Delhi still hasn't got 100% of the first shot to the people, and therefore we need to speed up on the first shot, and I'm sure the concerned people are doing. The third thing is that the people who have had 2 shots early enough in the year, let's say January to March, their antibody levels might be coming down. So they should be extra careful, because now everywhere it is only the Delta variant. It is not the Wuhan original virus. So we are vulnerable. So my suggestion would be, all those who are not vaccinated or only vaccinated once or have had early enough vaccinations, they should be careful. And all of us should wear both the masks as I am showing you. Next, enough is that after the second dose, also wait for 4 weeks. Do not think that today I get the shot and tomorrow I'll have antibodies. That's not possible. And festivals, celebrate at home in 2021. Don't mix up, send emotions, but not physically.
Right. So, Doctor, you think, we need to continue for being very, very cautious, and do you still have fears of a third wave, or, we've been told it's not going to be as bad as what we saw in the second wave, but do you think now with so much of Delhi having already been infected and now people receiving the vaccines that we'll actually have a big surge?
There are 3 parts. First, that those who have got either the vaccine or the virus infection in the past, it is not certain what antibody levels they have made. The sero survey of 58% showed only 25% had high enough antibodies. Also, we do not know what is high enough antibodies. So do not be under that illusion that you have got a virus and the vaccine, so you are protected. And second, as Kerala is struggling, anywhere else the virus mutates and we may have a new variant any day. And that can be a cause for concern all over the country, including Delhi. Third,
that really is a fear, and hopefully we won't see another variant emerging. But yes, keep looking at the situation in Kerala. That's a cautionary tale there. Thank you so much, Dr. Shenoy and Dr. Sreen, for joining us on the program.